Hey you guys, my name is Isabela Lima, ready for a dose of reality. So today we're going to be following a discussion on tetanus. So if you're unfamiliar with what tetanus is, it is essentially an infection of the nervous system caused by a bacteria called Clostridium tetani. This bacteria will enter the body and produce two harmful toxins that will cause painful muscle contractions. Another name for tetanus is commonly known as lockjaw. And in general, some of the hallmark signs and symptoms of tetanus is that a person's neck and jaw muscles will lock or harden, making it hard to open the mouth or to swallow. Clostridium tetani. Clostridium tetani is known as an obligate anaerobe. It is saprophytic, meaning that in general it'll obtain its food by absorbing dissolved organic materials or compounds, and you'll find them in different fungi and soil bacteria. And then also Clostridium tetani lives both in indoor and outdoor environments, so you can find C. tetani just about anywhere, though it will prefer soil and manure type of environments that are very warm. So definitely tetanus is more prevalent in the southern states than it will be in the northern states, for instance. And then C. tetani is seemingly indestructible, so it is a spore-forming organism, as you can tell here by this right image. This is a positive gram stain, and so with the positive gram stain showing up red, you can see the green endospore showing up at the end of the head, and it almost looks like a lollipop. And essentially by it forming spores, it makes it very difficult to eliminate. It is practically indestructible. So this also means that it can withstand extremely high or extremely low temperatures, which is really interesting. In general, you'll contract C. tetani or tetanus from a wound, such as a burn injury, something possibly post-surgery if you did surgery with a contaminated piece of equipment, an intravenous drug, using a contaminated needle, for instance, or even gangrene. And then some of the dangerous toxins that C. tetani produces makes it the second most dangerous kind of its genus, first one being Clostridium botulism. And some of the exotoxins produced by this bacteria are tetanospasm and tetanolysine. So a little bit more on these dangerous toxins are that tetanospasmin will take up the nerve terminals in the peripheral nervous system and interfere with that acetylcholine release in the neuromuscular junction. So if you're unfamiliar with acetylcholine, it's a neurotransmitter that'll help stimulate muscle movement, essentially. And the neuromuscular junction is just that junction between a synapse and two different muscles. And the initial presenting symptoms of tetanus is normally a flaccid paralysis, so the stiffening of the muscles and the paralysis of the body, and the inability to control what your muscles are doing. And these symptoms typically resemble effects of C. botulism, which is the most dangerous kind of tetanus that's out there. And then the toxin that C. tetani produces with tetanospasm will also, once it's done going from the peripheral nervous system, it'll travel to the CNS, where your brainstem and your spinal cord are, and it'll produce its characteristic symptoms there. So with your brainstem and spinal cord, your brainstem has this piece of it called a medulla oblongata, and it generally assists in the respiratory, and so your ability to breathe will get affected, and then the spinal cord also affects your muscle movement. So once the toxin has traveled to there, it is pretty difficult to reverse any of the symptoms. And then tetanolysine is the second toxin that C. tetani will produce. In general, tetanolysine is known as a hemolysin, so it'll cause destruction of the tissues and red blood cells, which is why treatment and early treatment of this disease is very important. Some signs and symptoms of tetanus. So in general, the average time from infection to appearance of these signs and symptoms will be generally around 10 days, but you'll see a total incubation period for this bacteria in a period of 3 to 21 days. So anytime within that period, tetanus could potentially come up if you've stepped on a rusty nail, for instance. And then the most common type of tetanus that you'll generally see is called the generalized tetanus, and this tetanus will tend to affect the whole body and not just a particular site or anything like that. And then these signs and symptoms, as we saw from the 10 days or 30 to 21 days, it'll begin gradually and then worsen over the span of 2 weeks. And it'll typically start at the jaw and then progress downwards. And so a lot of people will start with a cephalic tetanus, and then it can worsen into a generalized tetanus. Some symptoms that you'll commonly see are stiff jaw or locked jaw, where it's hard to swallow. The abdominal and back muscles will tend to stiffen. Your facial muscles will contract in a very odd and particular way and kind of just stay stuck that way. You'll have tachycardia, you can have a febrile fever, you can have diaphoresis, so sweating across the body, painful muscle spasms because they're uncontrolled, as well as trouble swallowing. So the different types of tetanus, there are four. The most common type is generalized tetanus, followed by neonatal, localized, and cerebral tetanus. So generalized tetanus, as seen here, will tend to affect the whole body. It is most common in 80% of the tetanus cases that are presented here in the United States. And again, as there's a descending pattern associated with tetanus and its signs and symptoms. It'll start at the jaw, progress to the neck, and then you'll go down to the abdominal and back muscles. As you can see here, the head is pretty stiff, and then the neck, and then the back and abdominal muscles have just straightened out in a way that's impossible to reverse. And then you'll also have autonomic instability, which is essentially your inability to alter your heart rate with exercise. You're sweating, you're going to be sweating a lot, so diaphoresis. You'll have difficulties with digestion, so anything to do with the parasympathetic will kind of go haywire. And then also you'll have frequent spasms that can last up to 4 weeks if not caught early on. So full recovery is possible with the right treatment. But you really do need to catch it on within that 10-day period of contracting tetanus. So some examples of treatment would be early wound debridement. So you can cut off that area that was infected. You can use antibiotic therapy. You can use an early intramuscular or intravenous administration of HTIG, which is essentially human tetanus immunoglobulin. You can even use a neuromuscular blockade, and so the toxins that are produced by tetanus will affect your muscles, and so if you can blockade that toxin from going anywhere else, that would be a great prevention method. And essentially, if the person's just kind of gone too far, kind of as this individual here on the left-hand side has, all you can really do is manage their symptoms and make sure that they're in a position of comfort. And then this can be really hard to watch too, but neonatal tetanus. So generalized tetanus form, so this form of neonatal tetanus is a generalized form of tetanus found in a newborn. And a way that a newborn can contract this is that if the mother is unimmunized and the baby is born without passive immunity, so they're not protected and they contract the disease. The most common way that babies will contract tetanus will be an infection of the unhealed umbilical stump. So when they go to cut the umbilical cord off, if that piece of equipment is not sterilized, that there's a high possibility that tetanus is there, which without catching this early on, there's a high fatality rate without therapy. And then some signs and symptoms that you'll see in babies who have this neonatal tetanus is a form of irritability, lots of crying, poor feeding. They'll be grimacing a lot because they don't have any ways to communicate that they're in pain or struggling. They'll have the normal symptoms of rigidity and muscle spasms. But interestingly enough, rather than just having these automatic muscle contractions, these muscle contractions will be triggered by touch. And so by touching their legs, by touching their head, by patting their hand, that'll cause that muscle to spasm. And so essentially by not treating this, fatality is pretty high. And then besides generalized or neonatal tetanus, you'll also have localized tetanus, which the prevalence of this type of tetanus is pretty moderate. Moderate to rare. I wouldn't say it's completely rare. The rarest kind is cephalic. But in general, localized tetanus will show up at a specific body part, so it can show up just on the face, it can show up just on the hands, just on the feet, as seen here on the left. And these muscle contractions tend to be smaller and more persistent, but also much more painful. They're uncommonly fatal. Typically, if you catch this at a particular part of the body, if it gets really extreme, you can amputate, but in general, you'll follow the same treatments that you would for generalized tetanus in terms of antibiotic therapy, wound debridement, etc. But sometimes these symptoms just go away, so that is something something that you have to be mindful of. The most rarest kind of tetanus is cerebral tetanus, as seen here on these MRIs. So in general, cerebral tetanus will be limited to the muscles and nerves of the head. It is rare because usually it occurs after some form of head trauma, so skull fractured, head lacerations, eye injuries, etc. You'll present with the same signs and symptoms that you would with any kind of tetanus, so neck stiffness, dysphagia, or the inability to swallow, and lockjaw, so stiffness of that jaw. And then the reason why you see cerebral tetanus will be that the facial nerve has been impacted. So you'll also see a lot of other cranial nerves being involved, such as the eye or the nose. And just with any of the other tetanus forms, it can also progress to a generalized tetanus if not caught on early on. And some complications of having cerebral tetanus can be a paralysis of the respiratory or even laryngeal muscles, and respiratory and cardiac failure. So if you look here at these MRIs, you can see just up here you have the before photos, and here you have the after, how the brain has been impacted. So you see that the brain size has shrunk. If you see any images with lots of white, that means that there has been a buildup of toxins or even rupturing of certain blood vessels. If you see any black, then the black will mean that there's a lack of blood flow to that particular area, because the toxin hemolysin has destroyed essentially those red blood cells and tissues that are there. So how would you prevent something as dangerous as tetanus? Well, vaccinations would be a great start. So you can prevent tetanus with multiple boosters, and essentially by getting this vaccination, you can prevent the effects of the toxins that are very dangerous. In general, this vaccine will come in a series, and so it's also known as Tdap. You'll see this vaccine series be shown as an attenuated combination vaccine that protects against 3 different kinds of diseases, so diphtheria, tetanus, and pertussis. Essentially, diphtheria, if you're not familiar with it, it's just a throat and respiratory infection. Tetanus is a lockjaw and stiffening of the muscles, and pertussis is also known as a whooping cough. In general, children who are getting this Tdap vaccine will get the series at 2, 4, and 6 months, as well as around 15 to 18 months, and then again at the age of 4 to 6. It's very important that you have these boosters, just because the vaccine, it's not very strong, and so you need multiple rounds of it. And then once becoming an adult, which in the medical world an adult is age 11 to 12, you'll just you'll receive the Tdap vaccine every 10 years. And in general, when receiving the tetanus vaccine, you'll retrieve it via intramuscularly, and so either on your deltoid or on the side of your thigh or your butt, even just wherever there's a lot of muscle, you'll receive that there. And then here's some U.S. trends that I thought would be really interesting to show. So the Tdap vaccine was discovered or created in 1948. So up until 1950, you saw a really high number of tetanus cases. And it wasn't until the release of this vaccine in 1948 that you saw a gradual decrease. And then in the 2000s, you have a stagnant amount of cases, and so every now and then you'll see a sporadic case show up, but in general we've done a pretty good job at vaccinating our populations and making sure that tetanus isn't as prevalent as it was once in the 1950s. So thank you for watching.